Hi everyone there, welcome to Kids Health Talk. Today we are going to discuss about triaging of sick children. I encourage you there to subscribe and follow me up for any health information that you would require. This is a home whereby you're going to learn about many more things about health. So in general, when triaging sick children, there are signs that a triage nurse looks for. These are emergency signs, priority signs, non-urgent signs, or non-priority signs. What comes in your mind when you hear of emergency signs? In a hospital setup, emergency signs are arranged in order. That is A, B, C, D management. So A means airway. Airway, an airway that is obstructed. It can be obstructed by secretions, can as well be obstructed by an object. It can also be obstructed by choking. B means breathing. If the child is not breathing properly, that's an emergency sign. So central cyanosis, this is whereby the tongue is blue in color. Any bluish coloration of your tongue is central cyanosis, and it's an emergency sign. Severe respiratory distress is when baby might breathe very fast or the baby is gasping for air, and that needs intubation. So you are not supposed to wait there at the waiting bay. Hello? You're not supposed to be waiting at the waiting bay when the baby is not breathing well or when the baby have obstruction. There is also weak or absent of breathing at all. This is a baby that is not supposed to wait at all. The baby is supposed to be moved as fast as possible in an emergency area, and life support procedures are commenced. And also given oxygen, weighing if possible. If it's not possible, the previous weight will be used. C, we go to circulation. Circulation, it means blood circulation, blood moving in the body of your child. So what do we look for? They are cold hands with any off. When you feel the hands, you can feel they are either cold. With any off, capillary refill. Capillary refill more than 3 seconds. When looking for capillary refill, you normally press the finger like that. And if you see that the blood return is very fast within 3 seconds, then there is good circulation of blood. But if it goes beyond 3 seconds, then this means that the circulation is not good, and that's an emergency sign. There is also weak or fast pulse. Normally in adults, you listen here. You feel it here. It can either be weak or fast. In children, it can be through SpO2 sensor, or the doctor or the nurse listens to the heart. So it can be weak or fast pulse. Slow pulse means it's pulse below 60 beats per minute. Absence of pulse is an emergency and needs to be sorted out as fast as possible. There is another C, which is coma, convulsing, or confusion. So what do we mean by coma? Coma, this is a baby who, when stimulated through pinching, that is pain, calling, they are not answering at all. That's an emergency. Needs to be moved in the emergency area. There is also convulsing. Convulsing, the baby can be actively convulsing, or you came in the hospital simply because your baby convulsed at home. It's an emergency. Why do I say it's an emergency? Because you can be waiting there at the waiting bay, then your baby convulses again. So that's why we are saying convulsing is part of emergency sign. There is also confusion. When you look at your baby, you see that they are confused, or the baby is confused and you don't know what to do. It's also classified in the emergency sign. D means diarrhea. What are the signs of diarrhea in children? They can be having sunken eyes. Done with emergency signs. So I would like to talk to the mother, the father, or the guardian of any child. If you found out any of those emergency sounds, please, you're supposed to move as fast as possible to a triage nurse, explain, and be moved to the emergency area as soon as possible. Number 2 are priority signs. Which are those priority signs? Okay, this priority sign means they are not emergency, but if ignored, they can turn out to be emergency. For example, tiny, sick infant aged less than 2 months. They did not fit in to be emergency, but if ignored, they can turn out to be an emergency. So tiny children are given a priority. Temperature means it's not an emergency, yes, but if ignored, if you wait for long, the baby is, for example, having 39.5 degrees Celsius. So if you're going to wait for long, the baby can end up convulsing, moving now to the emergency sign. So it's a priority signs that need to be sorted as fast as possible. Trauma can fall in emergency, else in priority sign. Pain, a child in severe pain, if ignored, can be an emergency. So a child's pain should be sorted as fast as possible. Poisoning, mother reports that the baby was poisoned or took poison. It's not an emergency, yes, but it can turn to be an emergency. So you're supposed to be triaged as well. Pallor, severe palmar pallor. Like if you observe the hands of your child, it's supposed to be pink in color. But if you find that it is whitish, we normally say maybe paper white, or pinching the capillary refill, you find out that it is more than 3 seconds, then that's a priority signs that needs to be sorted without waiting. If the baby is restless, irritable, or floppy, this could disturb the mother very much, as well as the baby, as well as the children waiting for triage. So it should be sorted as well. If you fall in respiratory distress, it should be a sign that should be sorted out as fast as possible. A child that has an urgent referral letter, it should be sorted out because they were referred for further management in your health, in a health facility. Malnutrition also falls in a priority sign. You could be having visible severe wasting, so it's a priority sign because this baby needs to be sorted as fast as possible. Also, edema of both feet, it should be a priority sign. Edema of both feet, it's let's say swelling of your lower limbs. This swelling could be because there's a problem with your heart, or there's a problem with your kidney. Burns can fall in priority sign, else in emergency signs. Severe burns, for example, burns involving the face, head and neck, that should be emergency, simply because if you wait with your baby, if you wait with your child in the waiting bay who happened to have burns up to the neck level, you could be waiting and those tissues can be inflamed in such a way that they are going to press the airway, making your baby not to be able to breathe properly. Therefore, severe burns up to the neck level are supposed to be emergency. Let's move to non-priority sign or non-urgent sign. These are signs that do not fit in emergency sign or priority sign. For example, if you brought your baby back for review, it doesn't fit to be emergency, neither does it fit to be priority sign, but that doesn't mean that you're not going to be given the services. You're going to get the services, yes, but this is after we have sorted out the emergency sick children and the priority sick children. Also, for example, a mother or a parent comes in, tells you, could you please help me to fast track my baby because we are going back to school. This is a child who can be able to wait for us to sort out that emergency child, and then later we come to sort you out. I didn't say that you're supposed to be sent back. No, you came because you had a need, and that need should be sorted out. I'm happy that you're here and you followed me up. I'm also delighted that I've educated you on the emergency signs, priority signs, non-urgent stroke non-priority signs in sick children. If you share this information, it's going to reach so many people across the world, and that will help us in managing stroke triaging sick children, because the parents stroke guardians will be aware of those signs that they are supposed to look for at home to rush their children to the hospital. Until next time, goodbye. Thank you for watching.